said first should be the character of the case taker, case taking practitioners. He will listen, he will write, then he will remain silent, he will talk less, and he will listen to the patient more. And after listening, he will ask questions. And after questioning, then he will go for examination. So he says in the aphorism 90 that the practitioner writes observed signs. Observed sign means what he observes in the patient. So these signs, it is translated into examination, general examination and systemic examination, which we will discuss later on. Then Hahnemann said how to take the case of chronic disease. Then he said that once you have taken the case, the most difficult task of treating the patient has been done. So he himself said that case taking is the most difficult task. So we understand our practitioners that actually everything depends on our case taking. Then he said after taking the case, you go for selection of remedy. For selection of remedy, he emphasized here, you see, that the physician should pursue to pick out the characteristic symptoms to choose the most appropriate homeopathic remedy from the materia medica. After you take the case, you must pick out the characteristic symptoms of the patient. You need not take all the symptoms of the patient, what he said. The patient may have said 80 symptoms or about 100 symptoms, but you need not take all these symptoms to select your medicine. So what you will do, Hahnemann said, you pick out the characteristic symptoms. And in another aphorism, 153 to 154 of Organon, he said that you take only the uncommon, strange, and characteristic symptoms. We will discuss afterwards this thing. And then we will discuss in separate topics that how to select the remedy and how to pick out the characteristic symptoms. In Bengali we say Lokkon Basai means picking out the characteristic symptoms or the peculiar symptoms. Now, when you have taken case history of a patient in homeopathic system of medicine, it comes like this, you see here. In the case history, first you write the particulars of the patient's identity. I discussed it in the last lecture, that you write everything about his name, father's name, his age, marital status, and everything. And each point has some importance. I discussed it in the last lecture. Then after writing the patient's identity and address and everything, you go to pick out his symptoms. You ask him what is your most important complaints or what is your chief complaints. Now patient will say according to his complaint, according to the severity of his complaint. So usually they start by particular symptoms. Let's say giving headache, or he may say that I have dyspnea, difficult respiration, or he may say I have flatulence or pain in the abdomen, or maybe constipation, or maybe in the urine he will say that I cannot retain urine, there is frequency of micturition, there is burning in the urine. So he will start usually by giving you particular symptoms. So Hahnemann said, Hahnemann said in the case taking part in from aphorism 83 to 104 that after you have taken patient's statement, then you see what systems or organ the patient did not say anything about. The patient maybe he said only about his respiratory symptoms, he has itching, or he has headache, only this thing. But then Hahnemann said, you will have to ask him about the systems or organs about which he did not say anything. Now you say, okay, he did not say anything about your bowel. How is your bowel habit? How is your stool habit in the morning? Or do you have any flatulence, have any pain or this and that? So you ask about elementary system. Then you may go to sexual system. That what is about your sexual health? Do you have any problem? Do you have any problem in the desire, erection, or ejaculation? Or if a female, you can ask her about her menstrual history, about her any complaint associated with her genital system. So you take all the systems one by one. You ask the patient about this. If you find any symptoms, you write. If you don't find, okay, you only write that there is nothing. In that way, you collect all the particular symptoms. Then you will have to go to general symptoms. Also, patient did not say anything about general symptoms. But this is very important for you to select the medicine. What are the general symptoms? We will discuss afterwards. After taking general symptoms, you go for mental symptoms. Also, patient did not say anything about it. Patient did not say that he has forgetfulness, he forgets everything whenever he hurts, or he is afraid of dog, he is afraid of snake, or this and that. He is very much angry, he is untidy. About this, he will not say anything unless you ask him. Because he came with his particular complaints only, symptoms of particular system. So you will have to take general symptoms and mental symptoms by asking the patient. After this is the history of present illness. Now you go to past illness. If he has any past complaints, as Hahnemann said, particularly in chronic disease, you will have to ask about his habits, diets, his past illnesses, his family illnesses, this and everything. So we go for past illness. About past illness, I want to say, you emphasize only the important illnesses. You don't need to write that he said, oh, before 15 years I had a diarrhea. There is nothing in this information. But if he says that yes, before 15 years I had a severe eczema in my body, which was, say, suppressed by putting ointments and tablets like this. Or if he says that I had an operation, I had something in the bowel and there was some operation. So you will have to ask about the operation and nature of operation. So about past illness, you will ask the important illnesses. After asking past illnesses, you ask him about his occupational history. What is the nature of his work? What he does in his work? If there is any problem or there is health risk in his occupation, you ask him. Then you ask him about his drug history. He may have come to you from an allopathic doctors or maybe homeopathic doctors. If homeopathic doctors try to know the medicines he have taken before coming to you, if at all possible. If not possible, okay, no need. Then if he came from allopathic hands, say a patient of bronchial asthma, he has been treated by allopathic chest specialist for a long time. So you might ask him what medicine he have taken. He may have said that I have taken inhalers, nebulizer, then some steroid, some bronchodilator, like this. So you can put in your history that he has taken steroid or some particular drugs for a long time. Then you go for family history. Family history is very important as well. And also in family history, you go for important illnesses. Particularly of his family members, means his father, mother, sister, brother, son, daughter, wife. These are the core family members. And also you will have to ask the first great family members about his aunt, about his say uncle, about his cousin, about his nieces, like this. Further this, maybe you don't need. So, your core family member and first degree relation, what he had. So, if there is a trend, he has bronchial asthma, so ask him, do you have any family member having bronchial asthma before? Your mother, your sister, or your father, maybe your grandfather? You can ask if there is a tubercular history in the family. This is important. If the patient had any blood disease, say thalassemia, she has say thalassemia trait, you ask what about his other brothers and sisters or mother or father, if they have any such disease, if there is some psychotic disease, because he came to you, say, with bronchial asthma, this is a psychotic disease. So ask about his father's or mother's history about any psychotic illnesses. Maybe his mother had tumor in the ovary, his father had prostate, enlarged prostate, or something, some problem in the urethra. So like this, you take the history. So up to this is the written portion of the history. You wrote everything. Now you go for examination. You see, we can divide the case history into, say, about 3 parts. First, you write something up to family history. Then you go for examination. You put the patient on your table. Then you examine. Examination are of 2 types. We'll discuss afterwards. One phase is called general examinations. Then you go for systemic examinations. We'll discuss afterwards about this examination. After all this examination, also you write in the history what you found. What is his pulse? What is his blood pressure? What is about his heart, his lungs? If he has any problem in the liver, okay, you write that liver is enlarged or not, if he has jaundice or not. Like this, you will have to write from the findings of your examinations. Then you make a provisional diagnosis. Just what is the disease condition with him? So maybe you write that he has bronchial asthma. This is clear. Or he may have some cirrhosis of liver, or he may have some, say for example, hemorrhoids. He may have chronic anal fissure, or he or she may have migraine. Like this, you write a provisional diagnosis. Upon this diagnosis, you may need to write for some investigations. Say, for example, patient said that he had chest pain, and whenever he ascends a stair or he walks some length of distance, he has pain. So, you think that maybe patient his age is like me, 68 years. So you suspect that he may have something in his heart. So you write one ECG. If ECG gives there is nothing, okay, don't go further. But if the ECG gives you some hints that he has some strain, some maybe he had previous ischemic heart disease. If you find something here, you can go for echocardiography or maybe TT, ETT. Accordingly, if you understand these examinations, investigations, if you don't understand, okay, don't go for this. If the patient has, you think that he has some kidney disease, why? Because he has some edema, swelling in the foot, his urine is very scanty, then he has some pain, and you suspect that he has some kidney problem. Then you write one, say, urine for routine examination. You may write an ultrasonography to see his KUB, kidney, ureter and bladder. Or if the patient is maybe a female, giving excessive bleeding from the uterus, this is say menorrhagia or metrorrhagia. You could write one ultrasonography of her female genitalia. She may have some fibroids uterus or may have some problem in the uterine endometrium. So accordingly, if you understand this thing, you can write for some investigations. But we will not wait to find the investigation to give her first medicine. No. Just we'll write it, okay. When you come next time or maybe after 1 week, you give me these investigations. But with her present symptoms, you can give her the first prescription. Next time when she will come with ultrasonography report or maybe other blood report, urine report, then you can make this is called confirmed diagnosis. First is provisional diagnosis, provisional. But after this investigation recorded, yes, what diagnosis? That she has fibroid uterus with excessive vaginal bleeding, or maybe that he has ischemic heart disease. This is confirmed diagnosis. So one must ask why we homeopath will go for such pathological term or this name of the disease, because we'll have to know this thing to know the prognosis of the patient, the course of disease condition of the patient, and to some patient will not let you go without knowing the actual disease condition of his body. So he will ask you, what is the problem in my say kidney? What is the problem in my heart? Why I have pain here? So you'll have to satisfy his query, and also you should know that prognosis that he has severe heart problem. You found that in his coronary angiography 3 blocks, more than 90%. So you'll have to consider this thing, that how you treat him, or maybe you will not treat him at all, or you may refer him to some other specialist. For that, we know some sort of diagnosis. But for us, homeopath, maybe we don't diagnose pinpointly. Okay, we have some general diagnosis enough, that he has some ischemic heart disease. He has some valvular heart disease. I don't need to know that whether it is mitral stenosis or maybe aortic stenosis. I need not know it. If I know only valvular heart disease, this is enough. If I know that she has some tumor in the uterus or ovary, okay, this is enough. Not more than that. Okay? Now about treatment, I told you treatment should be given before confirmed diagnosis, because when the patient came, you took the history and you will have to consider his symptoms and find out a medicine and give treatment, first treatment. And you give treatment means medicine, and you direct him about his diet and regimen as well. And after that, you tell the patient, okay, you come after 3 weeks or maybe after 1 month. After finishing all the medicines, he will come back and he will give you the follow-up. That okay, after taking your medicine, I am feeling better, or maybe I am feeling worse, or I don't feel anything, no change, something like this he will say. So with these findings, you will go for second prescription. So up to this we will discuss in this lecture. So now we will go for examinations. We finish how to take the history. Now we will go for examinations. And examination, Hahnemann said to do the examination. Where you see, Hahnemann said in aphorism 90 that the physician will record what he observes in the patient. So what are the examinations? Now we will discuss. Okay, before that also we say something more here. Before going to examination, I will have because I told you we take the history of the patient and take his particular symptoms, general symptoms and mental symptoms. This thing needs some elaboration. That's why before going to examination, I'll discuss about what are the symptoms to take from the patient. You see, we take particular symptom first. This is a particular symptom first. As the patient complains, maybe patient came to you with headache. Okay? You wrote that, where is the headache? What is the modalities? Like this, you write headache. Then you ask him, you have anything more? He says, yes. I have flatulence. I have indigestion. I have, say, for example, constipation. Like this, you will say, okay, now you write, he has flatulence. What are the modalities? It is before eating or after eating, something like this. Then you ask him, anything more? He says, yes. What? That I have some itching also. I have eruption in my groins, eruption in my back, something like this, he will say. Now you ask him, you have anything more? He will say no. Then Hahnemann says in the history we found that now you ask the patient about the symptoms of system which patient did not say anything about. The patient did not say anything about urinary system. So ask him that do you have any problem in the urine? Maybe you find some symptoms there where he did not necessarily before. He may say yes, yes, yes. What? Yes, he said that when I go for urine, it passes very slowly. The flow is very weak. And after ending the urination, I find that it is not cleared. Something remained behind. Or he may say, or you may ask him that, as you say, your urine flow is very weak. Okay, if you stand up, what is the change in the urine flow? Yes. If I stand up, my urine flow becomes better. You see, good symptom you found. Then you ask him, he did not say anything about male genitalia. Ask, do you have any problem in your sexual function? Then you find, yes, doctor, I did not say anything about it, but I have erection problem. I have erection only, it's a 20% erection and very quick ejaculation. Maybe he will say. Before he did not say because he came with his headache. But he forgot or he did not think that to say about his genital problem in this point. To go on asking question system by system. If in any system you find nothing, okay, right, there is nothing. If you find some symptom, you write the symptoms. In this way, you take all the particular symptoms all over the body because you are treating the whole patient, not one system or one organ. So you take symptoms from all the systems of the body. You have to ask. That's why homeopathic case history takes time. After particular symptoms, you go for general symptoms. I said before. After taking particular symptom, now you ask about general symptoms. What are the general symptoms? Now I will ask. You see about his constitution. This one not to ask, just you observe and write. Patient is very obese or maybe very thin, patient is tall, patient is short or stunted growth. Maybe the child mother will say that he is 12 years boy but he looks like 7 years boy. He has stunted growth. He is late in working. Mother will say that he started working after 3 years. So this thing, it comes in the constitution. So in your history part, also you write one point, the constitution. What is the constitution of this patient? Then you ask him about his warm and cold behavior. He feels worse from warmth or cold. This is very important. Some patient may not understand, but you will have to clarify the thing that how do you feel generally, not cold about your rhinitis or coryza, no. How do you feel in the cold weather? You feel it better or worse? So this is general symptoms. Then you ask him about he likes open air or in the room he feels better. He likes sun heat or not. Or if he goes to sun heat, he has much problem. Then you ask him about his bathing habit. He likes bathing or he's averse to bathing. He's aggravated after bathing or he gets better after bathing. He takes cold bathing or warm bathing. He will say, I take cold bathing even in winter. This is very important. So these are general symptoms. He will not divulge to you or tell to you unless you ask him. Because he did not think that these are important for his complaints with which he came. So you'll have to ask and collect. Then you ask him, thirst. I wrote here about the main general symptoms. There are others also. These are the main thing you will have to collect. About his thirst, you ask him, what about your thirst? You are very thirsty or thirstless? He may say, or mother will say about her child, no, he does not take water at all. So he is thirstless. Or if he says, no, I take water, then you ask, You take little amount at a time or take more? You don't know, I take more. Okay, if it is more, you take very often or not often, like this. Or you can ask, he likes to take cold water or not. He may say that every time I like to take fridge water. So this is about thirst. Now you ask him about his appetite. His appetite, that is lack of appetite decreased or appetite increased. Then you ask him if he is hungry, he can tolerate or he feels some symptoms. He should know, if I get hungry, I become very much irritable. I have pain in the stomach or I feel very bad, something like that he will say. So you write that hunger aggravates. If there is a particular symptom, also you write that in hunger, he becomes irritable. Then you ask him about his food habit, his desire, aversion and aggravation to particular foods. You ask him, here I wrote the main things, but there may be some smaller things also you can ask. Sometimes we ask him about sweet, salt, chili, sour. Do you like or do you don't like? About meat again with fat or without fat. Then fish, egg, milk. Then about food, it is cold food or warm food he likes. Drinks, it is cold drinks or normal, or maybe ice cream. Like this you ask about his food habit. Also you see, he will not give you these symptoms unless you ask him. But these are very important for selection of medicine. Then you ask him about his sleeping habit. This is good, this is light, this is late. Maybe he will say, I don't sleep unless it is 2 o'clock. Or it is broken very frequently, it is disturbed. Or he will say, I wake up particularly at 3 o'clock every night. Or I wake up 1 o'clock every night, or 1 to 2 o'clock every night. These are also important symptoms. Then you ask him about the position of sleep, whether he sleeps on abdomen or on his back or on his sides like this, or he feels fresh or unfresh after sleep in the morning, whether he talks in sleep. Also about dream. Ask him, do you see anything in your dream? Somebody said, no, I don't see anything. Or somebody may say, yes, I see, but I forget. But somebody say, no, I see falling. Every time I fall from some height, or some dead body, some snake, fire, nightmare, somnambulism, about this thing. So you see, these are your duties to ask the patient and collect this thing. These are very important for your selection of medicine. After general symptoms, then you go to mental symptoms. Why we keep mental symptoms at the end? I said in my last lecture that mental symptoms are very private symptoms, some personal symptoms. Patients sometimes may not like to divulge to you, to tell to you. So you need some sort of confidence building with the patient, so that patient has some confidence upon you that yes, he's a good doctor and he wants to know my conditions to give me good medicine. Then you ask him, he will give you all the symptoms. So we go to mental symptoms. Mental symptoms again, as you say, mind consists of 3 components. As Dr. James Taylor can say, of course other people also say the same thing. He said the mind consists of 3 components: memory, intellect, and will or emotion. Memory, intellect, and will. So we'll have to take symptoms in this category so that some you don't forget to take. So you take the first, memory symptoms. Why memory symptoms? Because patient will feel easy to say anything about memory, but there is no shame or shy saying about his condition of memory. So you ask him, your memory is very sharp or it is very weak? you are very much forgetful. If he says, yes, I am forgetful, I always forget what? Forgetful of names, only name he forgets. Or forgetful of recent events or past events like this, you ask him. Then you write about intellect symptoms. It is very intelligent, very sharp, or he has some mental retardation, has some idiocy, patient has any delusions. You will find some, say for example, some mental patient, schizophrenic patient will say, yes, I see some people talks with me and I communicate with him. Or some will say, yes, I find someone is controlling me like this. So these are all symptoms of intellect. Delusion, hallucination, delirium, confusion and mistakes. You will find so many symptoms in the repertory on this subjects. And we'll discuss also all these things afterwards when we will discuss repertory. After memory, after intellect, you go for will and emotional symptoms. These are most important. And you ask him very particularly about his fear and anxieties. Even sometimes you find the patient is anxious. It is written on his face. He is not taking any interest talking with you. So you ask him or ask her, that, do you have any anxiety? She will say, yes, I feel anxiety about my health condition. Because every now and then I have this disease, that disease. So I don't know this disease which I am suffering now, this will be curable or not. So anxiety about health, anxiety about disease, anxiety about family, anxiety about children, anxiety about future, like this. Then you ask, do you have any fears? Very important, very, very important. And also you should know what fears you expect from patient. And this thing you learn from repertory, we'll discuss afterwards. So maybe she will say, no, I don't have any fears. But if you ask particularly, then you find that she has so many fears. You ask her, are you afraid of darkness? To be alone in the dark? Any fear about ghosts, booth, jinn, like this? If says no, okay, then go for another thing. Do you have any fear about animals like dogs, snakes, even rats, mice, rats, cats or cats, cubs, even insects, cockroach, any crawling insects like this you ask. Then we go for, do you have any problem or fear of storms, thunderstorms? Do you have any problem or fear of height? Maybe she will say, yes, I am very much afraid of height. I cannot see the lower thing from height. Do you have any fear of some particular disease? She will say, maybe you find the patient will say, yes, I am afraid of death, fears of death. But why? Why you will die? That she said, I am afraid of my heart. Maybe I'll die of heart disease because my heart is not going well. Or maybe she has some problem. She may have some cancer phobia. She will say that I am always afraid of cancer. So these are very important symptoms. So you take very meticulously. Then you go for anger state. This is also very important. Then, okay, madam, what about your anger? Are you very mild and calm and quiet, or you are very angry? First thing. She will say, no, I have some sort of anger. Okay, what is the level of anger? This is very short lasting or very long lasting? You get angry at every trivial things, small things, or only after big problems you get angry? Then also you ask, when you are angry, what is your reaction? You beat somebody, you break something, you throw something, or you suppress your anger. Maybe you are very angry, but you don't express, you don't break anything, but you suppress it. Or I ask, if you hold any grudges about some bodies, because you are angry with someone, he said some bad words to you, And is this anger, you hold a grudge upon this guy, or you may be revengeful. That okay, I'll see him. Inshallah, the time will come, I'll see him. So you hold in your chest, in your heart, and you try to take revenge from him in suitable situation. Then you ask whether he's little bit dominating in his family. He must say, yes, in my family everybody must listen to me. In my office everybody must listen to me. If they don't listen to me, I make them tight. So he's dominating man. Or maybe he's very simple man. Or he may be dominated. You ask the wife, what about your dealing with your husband? She will say, oh, he's very angry man, and I cannot say anything to him what he does not like. I cannot express my likes or dislikes. She is dominated by husband. So one may be dominating and another may be dominated. This is also very important. You ask the child whether he is dominated by his father. Child may be dominated by father and give peculiar symptoms. You see, this is a good symptoms of carcinosin. Long domination by father. So these are very important symptoms, the mental symptoms. You have to ask meticulously and collect. And if you are an expert one to take such symptoms, you can find very good medicines and you may show very good result to the patient. Then we ask him whether he has any anticipation or timidity before public appearance. That he can talk anything, but in a crowd, in front of a crowd, he cannot say anything. He becomes shy. He becomes timid. This thing. Or you ask him whether he is homesick or he desire to travel here and there. You find some people, they don't like going outside. They always like one place, and home is the good place for them. But someone you find he is a vagabond or he is roaming about in here and there, he likes it very much. Then also you ask him whether he is tidy, untidy, or he is fastidious, or maybe he has some cleaning mania even, washing every time his hands.
Incoming voice call from Jamir Ali.
Jamir bhai, আমি একটা লেকচারে আছি, পরে ফোন করব আপনাকে. Okay. So you ask him, but you may find some female will say that, or husband will complain that she every time now and then she washes her hands. She will open the door for someone, then he will come and wash. He will count money and give to her servant, then he will come and wash like this. Also you can ask, why you wash so many times? Why? What is the reason? Patient may say, I am afraid of dirt, moila, dirt. Or patient may say, I am afraid of contagion, bacteria, virus, microbes. She may find, particularly in corona epidemic, people were very much afraid of contagion and washing hands very much. Also you ask whether he or she is very hurry or haste, always in hurry. It takes food very hurriedly. Or the opposite, whether she is lazy little bit, or procrastinate. What is procrastination? Procrastination means every time he has work, he will not do it today. Today's work he will do tomorrow or after, maybe at the last time. So to keep work, not doing readily, rather lately, this is called procrastination. It is a very good symptoms of medullinium. Also you ask him whether he has avarice, miser. He likes to keep money, not to spend money. So you ask, of course, you should not ask him whether you are miser. No, not ask. So ask with some technique. Then how do you spend? If you spend much, do you repent? Or say, for example, how you buy things for your family, how you buy foods, cheap food or very costly food. If you go to market to buy a cloth, if you choose a buy the very good one or just to pull on. In this way, just you find his status, whether he has avarice or not avarice. So you see, all these things, when you write, this is the history. And this thing, patient will not tell you unless you ask. Now you'll have to know what to ask. How do you ask him this thing if you don't know what are the things to be asked? That's why you have learned it also. And inshallah we'll discuss afterwards. Okay? So now we come after we have taken all the symptoms, particular, general and mental, then we will go for examination. What examination? Let us come here. We will divide the examinations into two parts. One is called general examinations. Another is called particular examinations. What are general examinations? General examination means which signifies the whole body. First you see the appearance or body build of the patient, as I said. It is not that patient should tell you, you just observe. Patient's body build. He's very fat, obese, or very thin, he's tall or he's short, like this. Then you see his decubitus. What is decubitus? What position he likes. Maybe this is a patient of, say for example, bronchial asthma. You find the patient always sits putting the head forward. So this is decubitus, his sitting position. What position he likes to relieve his complaint. Then you see about his nutritional status. He has very poor health. Maybe patient is very much poor, or maybe patient is not poor, rich, but the child does not take food at all. My mother will say he has no appetite. So you find his nutritional status is very low. Then you examine about his anemia, jaundice, cyanosis, edema and dehydration. So this thing you should learn elaborately by practical demonstration. We'll do it afterwards in our general inward examination paid classes. Here just I mentioned that you'll have to see anemia. Now you'll have to know where to see the anemia. You'll have to see jaundice. You'll have to know how to see jaundice. I find some DHMS doctors, just I said, because they are my own people. I ask, see jaundice. They cannot examine about jaundice. I say, where you see anemia? They don't know. How to see edema? They don't know. No. You'll have to know. Because we are doctors, and Hahnemann said, after taking the history, you'll have to examine the patient. And these are also symptoms, objective symptoms. The patient is very anemic. Patient is jaundice. Maybe the patient came to you with, yes, last night I had one patient, peri-ambulatory cancer. You see, he has bile duct at the end. There is one cancer obstructing the bile duct. When the bile duct is obstructed, patient will have jaundice. What type of jaundice? This is obstructive jaundice. And if you see the jaundice, then you find another thing. Patient has so much itching. So you have to know how to see the jaundice, how to examine. And then you see the vital signs. These four things, these are called vital signs. What are the things? Pulse, blood pressure, respiratory rate, and temperature. These four things are called vital signs. When a patient comes, patient is very much having headache, palpitation, or heart pain, or this, that, old man like me. So of course you'll have to see his BP, blood pressure. And you will have to know how to take blood pressure in a nice technique. Some people see the blood pressure, you find that this is not correct. So you'll have to know accurately how to measure pulse, how to measure blood pressure, how to count the respiratory rate, how to see temperature, how to examine temperature for a child, for an old man like me. or for an infant. And if you take the temperature from axilla, from tongue, from anus, how you will calculate? Because if you take from axilla, this is skin temperature, you will have to subtract 0.5 centigrade from the reading. Then it becomes accurate. So you'll have to know the thing, how to measure temperature. I find many of our homeopathic doctors, they don't know how to measure temperature. This is shame. So you have to learn. This is very easy, very simple to learn. Why you will not learn? You are a doctor, you don't know how to take the temperature of the patient. How is that? Then you will have to examine about clubbing, colonychia, leukonychia. If a patient has very respiratory problem, a patient has say, cancer of the liver, you find end of his finger becomes broad. This is called drumstick-like finger end. This is called clubbing. So from this you know that yes, he has some blood disorder, he has some congenital heart disease, or he may have something in his liver. You see? Koilonychia. His fingernail becomes boat-shaped. It becomes concave. So only by seeing this you know that he has iron deficiency anemia, you see. Then you'll have to know how to examine thyroid gland or any other limb gland. Mother will take her child, say, I find some tumors here. So you'll have to examine. And you have to know how to examine the neck glands. This is not the way. So you'll have to know how to mean group by group, the neck glands. You see? Then his glands in the axilla, glands in the groin. Patient may be of leukemia, one leukemia child came. You will have to examine all the body for his gland. Or a patient came from with Hodgkin lymphoma, lymph gland cancer. You will have to examine his gland all over the body. So you will have to know how to examine for lymph glands. Then skin condition. Patient has pigmentation here and there. Body hair distribution. Patient may be of PCOS, polycystic ovarian syndrome. You find the patient has body hair here. Female, say 20 years or 15 years, here there are hair growth in the female. You find hair growth from the umbilicus down to pubis. This is the line. Here female do not have hair, but male have hair. But in case of PCOS, yes, female will have hair there. So you have to know this hair distribution, and this hair distribution will dictate you about the diagnosis of the patient. What patient has in the body. Then you will have to see any deformity, congenital abnormality. Patient came with 6 fingers, you see. Patient came with problem in the knee joint. Patient came with squint in the eye. Patient came with cleft lip, cleft palate, like this. So you note it, because this will give you indication about your remedy even. Then patient may have some problem, congenital heart disease, the child having dyspnea. So if you put your stethoscope on the chest, you find that he has maybe some foramen in the heart. He has VHD, ASD. So these are congenital abnormality. Then any lump or swelling. Patient said that yes, I have one swelling here, say here. So you have to examine, and so you will have to know also how to examine a lump. There is a way. There is a procedure. Just you put your hand like this. No, this is not the way. And what to be seen in a lump? You will have to see its size. You will have to see its surface. You You will have to see its contour. You will have to see its consistency. You will have to see whether it is painful or not. So many things to examine a lump or swelling. Patient may have come to you with hernia or swelling near scrotum. So you have to know how to examine this swelling. So these are all about general examinations, and you will have to learn it. If you did not learn in your college, this is the shame for your college and also for you. Why for you? Because you did not learn from college, but you must learn it from somewhere. Because you need it in examining or in treating a patient. So this is a good chance for you. We will take these classes afterwards in our Malaysia Vedic Parishad classes, and you can learn all these things. These are very easy, only you will have to learn from some teacher, good teacher, of course. So these are general examinations. Now afterwards you will have to go for systemic examination. What are systemic examination? Systemic examination means systems examination. Say, patient, this thing you examine according to what patient complains. If patient says that I have problem in my respiration, I have wheezing, I have say some problem, I cannot take breath easily. If I sleep or if I lie down, I have problem in my chest, then I get up, something like this. So you think that he has problem in the respiratory system. So then you examine the respiratory system very elaborately. He has no problem in the alimentary system. So you may escape alimentary system, or you may just see his liver and spleen only. Okay. Or he may have some problem in his heart. He said, I have pain in the heart. Or he may have heart failure. So you will have to examine his heart and vascular system elaborately. You may escape alimentary system, or you can examine alimentary system very briefly. Patient may have problem in the nose. Patient came to you for adenoids. One child, mother said, we did the X-ray and the doctor said he has adenoid. So now you have to know how to examine his nose, how to examine his ear, how to examine his throat. Many homeopathic doctors, many, they don't know. I don't say most, maybe it is most. They don't know how to differentiate between an HIT and polyp. They say this patient has polyp. We examine and we don't find any polyp. So you have to know how to examine the nose, how to differentiate between a polyp and HIT. You will have to know how to examine the throat, how to use your tongue depressor, how to examine the tonsils, how to examine the back of the tongue, how to examine the teeth, then how to examine the ear. Patient says, I have pus purulent discharge from my ear. So you have to examine the ear. So these are it is called systemic examination. Examination of a particular system. This thing, you may not do all the examination, but the systems about which the patient complains. So you have to know about examination of alimentary system, examination of respiratory system, examination of heart and vascular system, examination of genitourinary system. Patient says, many patients come to me, they say, oh doctor, I have pain in my testes. And he will say, they will say that there is a cord-like swelling about my testes. So you have to know how to examine testes, spermatic cord. You see? So I tell, okay, remove your clothes, and then I put on gloves and I examine. You have to know how to see hydrocele, how to see hernia, how to see epididymal cyst, how to see varicocele. Very easy. Only you'll have to know it. Very easy thing. Only somebody should teach you how to examine. Then you could say, yes, you have varicocele. Yes, you have epididymal cyst. Yes, you have testicular, maybe he has testis, atrophied testis. Patient came to you that he has married 7 years, there is no child. And his semen report says there is azoospermia, I mean there is no sperm in the semen. So of course you will have to examine his testis. You should know what is normal testis, then you know what is atrophied testis. Maybe you find both of his testes are atrophied. Atrophied means dried. Patient may have, many patients comes to us with hernia. You'll have to know whether it is inguinal hernia or femoral hernia. And there is a specific way how to examine, you see. So you should know these systemic examinations. Then patient may have nervous system problem. So you should know what is upper motor neuron lesion, lower motor neuron lesion, how to see the jerks, how to elicit the examination sensation like this, how to examine the eye. You should to learn this thing. Then also examination of the ear, nose and throat, as I said. So these are very important things for a doctor to learn, because you will have to examine his patient to find objective symptoms. Okay? Now, this is an important thing. After you have taken the history, you have examined the patient and you have written on the paper. Okay, these are the symptoms and these are the signs. Signs means objective symptoms. Now Hahnemann said, okay, your history is complete. What you will do after, you go for remedy selection. After case taking, you go for selection of remedy. How to do it? This is very, very important topics. And Hahnemann said it very meticulously in aphorism 153 to 154 of Organ of 6th edition. Okay, we take hints from Hahnemann, what he said about it. Then we'll talk further. Hahnemann says, after you have taken, this is aphorism 153 to 154, we say, our guru, they said, there's aphorism 153 is the basis of homeopathic practice of medicine. This is the basis of homeopathic practice of medicine. You should know it very well and you should understand it very well. So Hahnemann said, after you have taken the history of the patient, maybe it took 2 to 3 hours to take the history. Okay? Now there are so many symptoms from head to foot, from mental in general, maybe 100 symptoms. So how to select remedy out of these symptoms? Because for a homeopath, he will have to find out a medicine which has exactly the same symptoms of the patient. Okay? Now patient gave you 100 symptoms. Should you consider to compare all these 100 symptoms to find in a remedy? No. It is impossible and not needed also. So Hahnemann said, out of all these 100 symptoms, you do sorting. In Bengali we say Lokhan Basai. You do sorting of symptoms, Lokhan Basai. Sorting of how to Lokhan Basai or how to sort symptoms. So Hahnemann said these symptoms will be peculiar symptom, unusual symptom, strange symptom, striking symptom, uncommon symptoms. This will be uncommon and strange. One example. Patient said, I have heartburn, too much heartburn, pain in the stomach. Whenever it is empty. When I am hungry, too much pain. Okay, then how it gets better? It is yes. As soon as I take some food, it is nice. The pain goes. So you think, oh, how nice this symptom. With this symptom, I can find a remedy. Because this symptom is complete symptom. Patient symptom gives location where it is in the stomach. Its sensation, it is burning. Modality is yes, empty. Stomach worse. Then after taking food, it is better. But it is not peculiar symptom. Why? Because out of 100 gastric ulcer patient, 90 patient will say, gastritis patient, that whenever he has empty stomach, he has pain. After taking food, it is better. This is a common symptom. It is not strange symptom, according to Hahnemann. So, how to find out uncommon symptoms? You see, if you are intelligent, you can search a uncommon symptom by common symptom. Okay, patient says, after taking food, he gets better. You ask him, what sort of food? He may say, if I take milk, yes, I am better. What sort of milk? Cold or warm? You will say, cold milk, oh, this I am better. Warm milk, I am getting better. If I take sweet, molasses, gur, I feel better. If I take ice cold water, I feel better. You see, it becomes now peculiar. It becomes now uncommon. So these are the symptoms you will have to search. You ask a child, are you afraid of dog? You see? Or are you afraid of, say, insect? This is not very much peculiar, you see. But if you find a old age woman, oh, she's very much afraid of cockroach. She's very, very much afraid of flying insect. This is peculiar. If you ask somebody, are you afraid of tiger? Yes, everybody is afraid of tiger. This is not very important. So you try to find out the peculiarity among the symptoms. Say patient will say for example, I have diarrhea. It may be in both ways. He will say, if I go for 3 or 4 times to diarrhea, I get very much exhausted. This is one medicine. Only after 2-3 times diarrhea, he becomes very much exhausted. He should not be. Maybe he says, after 8-10 times, I get exhausted. Okay, maybe this is conceivable. But only after 2-3 times he gets exhausted, this is peculiar symptom. Again, if the patient says, oh, today I have 20 times dysentery, blood dysentery, and after going to toilet for 20 times, still I am not exhausted. This is also peculiar. You see? So you can find out the, as Hahnemann said, striking, strange, unusual, peculiar signs and symptoms. And this thing Hahnemann says, you see, that these are the symptoms in the case almost exclusively the ones to which close attention should be given. You should give attention only these symptoms. And you see the words here. In Boric's organon, William Boric's translation, it is written most solely. These are the symptoms most solely to be considered. I found an American journal, maybe long before, maybe before 30 years. They criticized this translation of Boric, that how he said most solely. Solely. Why to write most? Solely means only this thing. Most solely, no, there you should not put an adjective like this. It is a wrong adjective. And Hahnemann should not have written such wrong thing. So they went to German original version of Hahnemann's. Then they found there it should be almost solely. You see, the translation is wrong. This German translation, it should be almost solely. These are the symptoms almost solely to be considered. Not, you cannot write most solely. You can write these are the symptoms solely to be considered, okay. But if you read almost solely, it means these symptoms also you may ask some other symptoms. It gives you some chance to consider some other symptoms also. That's why I put it here like this. But I find in my translation it is written almost exclusively, but it's all same. These are the symptoms almost exclusively to be considered, to be given attention, to select the medicine. So Hahnemann said, so you see, then Hahnemann said that this, if you select a medicine after considering only the peculiar symptoms, characteristic symptoms, uncommon symptom, that this medicine will be the most suitable one, the specific homeopathic remedy for the case. So, after taking the case history, your duty is to do sorting of symptoms, Lakhon Basai. And out of 100 symptoms, you will have to find out 8 to 10 symptoms or 12 symptoms only. And with these symptoms, you try to find out this is phosphorus or something. You see. So this is very important. This sorting of symptoms. And you will have to, you see, if you want to know the unusual symptoms, uncommon symptoms, then you will have to know what is the common symptoms. It means you will have to know the practice of medicine also. Because unless you know about duodenal ulcer or gastritis, if you know about gastritis, you know that whenever there is empty stomach, there is pain. And after taking some food, it gets better. This is common symptom because you read the practice of medicine. Then you know that what is the uncommon symptom? Yes, not only food. You will say this should be warm milk, this should be cold milk. Or for example, one patient has diabetes. Patient says that I go to urine many times a day and I take much water. I pass urine and I take much water. And I take large water often or maybe something like this. So this is good. And you find his tongue also very dry and he has maybe constipation. So these are good symptoms of bryonia. But if you know that this person has diabetes, then these symptoms become third-class symptoms, common symptoms. Because this person has diabetes, that's why these symptoms are very common. These are the symptoms of the disease, not the symptoms of the diabetic patient. So you'll have to know also the practice of medicine, to know about the disease symptom, to know what is uncommon. This is very important. So today I think, today we'll finish it here. To know these types of symptoms, we'll have to know classification of symptoms. So in our next day lecture, we'll discuss about classification of symptoms. Then we'll discuss about very important chapter, very, very important. I think many of our homeopaths do not know this thing. As I verified in many lectures, in many seminars. So this is very important. So this is called evaluation of symptoms. Quantitative evaluation, qualitative evaluation. So inshallah next lecture we'll discuss about this thing. These are very important thing. Then we'll discuss about totality of symptoms. Then we'll discuss about totality of symptom versus total number of symptoms. Very important as well. Then we'll discuss about selection of homeopathic remedy by repertory or without repertory. And also there are so many things in our lecture. We hope to finish this lecture again by maybe two, three lectures afterwards. Okay. Thank you very much for your kind listening. Now it is already 10:45. I am giving the microphone to Dr. Anwar Patwari. You can take some question only. And if there is any comments, this will be welcome. Okay, Assalamu alaikum. Dr. Anwar Patwari.
Hello, স্যার শুনতে পাচ্ছেন স্যার?
Yes, yes, yes.
হ্যালো,
Hello, yes. Hello. Hello.
জি, থ্যাংক ইউ ভেরি মাচ ফর ইউর এক্সিলেন্ট
Hello. Dr. Patwari, I can hear you.
Very cool, sir. I think.
Hello. I think he may have some problem with his laptop. Hello, Dr. Patwari.
স্যার, ক্যান ইউ হিয়ার মি?
Yes, I hear you. Yes.
থ্যাংক ইউ ভেরি মাচ স্যার ফর ইউর এক্সিলেন্ট ডিসকাশন। কারো কোনো যদি প্রশ্ন থাকে হ্যান্ড রেজ করলে আমরা আপনাদের নামগুলো ঘোষণা করতে পারবো। যদি কেউ কোনো প্রশ্ন বা মন্তব্য করতে চান আমরা কয়েকটা
বাংলাতে প্রশ্ন করতে পারেন। You are allowed.
প্রশ্ন বা মন্তব্য থাকলে আপনারা রেসপন্স করলে আমরা আপনাদের নামগুলো ঘোষণা করতে সুবিধা হবে, আর আপনারা আপনাদের মাইকগুলো আনমিউট করে আপনারা প্রশ্ন করতে পারেন।
Mridul Kanti raised his hand. Even ask Dr. Mridul Kanti.
মৃদুল স্যার, আপনার মাইকটা আনমিউট করে প্রশ্ন করবেন স্যার।
থ্যাংক ইউ স্যার। আমি বাংলায় বলি স্যার।
জি জি, ভালোই বলেন।
কিছুদিন আগে স্যার শরীর অসুস্থ ছিল,
জি।
আমি ইন্ডিয়া গেছিলাম এবং ডক্টর রবিন বর্মনের সাথে একটা মানে সাক্ষাতের সুযোগ হয়েছিল। তো তিনি সবচেয়ে মানে বড় বিষয় যেটা আমার কাছে মনে হয়েছে, আমি কত বছর প্র্যাকটিস করে জিজ্ঞেস করছেন, বলছে প্রায় অ্যাবাউট 50। তারপর কোন সংগঠন, আমি তো বাংলাদেশ গেছিলাম, আমি বলছি স্যার আমরা তো বাংলাদেশ হোমিওপ্যাথিক পরিষদের সাথে জড়িত। তো তিনি বললেন ডাক্তার শেখ ফারুক এলাহীর নাম, আমাদের অনারেবল সভাপতি। ইউ নো হিম? আমি বলছি স্যার উনি প্রেসিডেন্ট, আমরা ভাইস প্রেসিডেন্ট। আমার এত ভালো লাগছে, বাংলাদেশে আসার পরে উনি বলছে যে আপনারা সহযোগিতা করেন না কেন? আমি বলছি স্যার আপনি যেখানে গেছেন সেটাতে আমাদের সহযোগিতার কোনো উপায় ছিল না, ওইটা প্যাটার্নপন্থীদের কিছু অবস্থা। যে হ্যাঁ, পরে আমি বুঝছি। তা আসলে ওনার মুখে এরকম প্রশংসা দেখে আমার খুবই ভালো লাগছে এবং সত্যিকার অর্থে আমার মনে হয়েছে যে পুরো বাংলাদেশ হোমিওপ্যাথিক পরিষদটাকে উনি অনেক সম্মানিত একটা জায়গায় পৌঁছে দিয়েছেন। আমি এই জন্য আমাদের সভাপতি সহ অন্যান্য যারা আছে সবাইকে অনেক ধন্যবাদ জানাচ্ছি এবং আমি মনে করি তিনি বোধহয় খুব সম্ভবত শেখ ফারুক এলাহী স্যারের লেকচার শুনেন এবং সেভাবে কথাবার্তা বলেন। এই জন্য তিনি আমাকে বলতে হবে যে আপনাদের প্রেসিডেন্ট শেখ ফারুক এলাহী। তো হচ্ছে হ্যাঁ, আমি স্যারকে হ্যাঁ না স্যার বুঝতে
মাইকটা বোধহয় আনমিউট করা। মিস্টার সালাউদ্দিন, আপনার মাইকটা মিউট করেন।
জি স্যার, আমি মিউট করে দিয়েছি। ডক্টর মৃদুল কান্তি স্যার, আপনার মন্তব্য করেন।
আসলে এটা শুনে বাংলাদেশ হোমিওপ্যাথিক পরিষদ এবং সভাপতি সম্পর্কে ডাক্তার রবীন বর্মনের কাছ থেকে যা শুনেছি সেটা শুনে আমি আসলে সত্যিকার অর্থে অনেকটা মানে কি বলবো গর্ববোধ করছি আর কি, প্রাউড ফিল করেছি এবং আমার খুব ইচ্ছে ছিল স্যারকে এটা জানাবো। এই জন্য আজকে সবার মধ্যে এখানে উপস্থিত হয়ে এটা জানালাম। আর লিখছে তো অনন্য, সেটা তো বলার অপেক্ষা রাখে না। তো এটা তো আসলে আমার একটা জিনিস মনে হয়েছে, শুধু দেশে না বিদেশেও যে আমাদের সুনাম সুখ্যাতি ছড়িয়ে পড়ছে এই ব্যাপারে আমার কোনো সন্দেহ নেই। তো আমি আমাদের স্যারকে বলবো যে পর্যায়ে আমাদের ক্লাসগুলো চলতেছে সেই পর্যায়টা যদি আপনি অব্যাহত রাখেন তাহলে অনেক সুন্দর হবে। ধন্যবাদ স্যার সবাইকে। স্যার
ধন্যবাদ স্যার। আর কারো কোনো প্রশ্ন বা মন্তব্য থাকলে আপনারা হ্যান্ড রেজ করলে আমরা নামগুলো ঘোষণা করতে সুবিধা হবে। Anybody have any question? ডক্টর দীপ সরকার, আপনি হ্যান্ড রেজ করেছেন, আপনার মাইকটি আনমিউট করে প্রশ্ন করবেন প্লিজ।
আমাকে শুনতে পাওয়া যাচ্ছে?
জি জি শুনতে পাচ্ছি, আপনি বলবেন প্লিজ।
Sir, I want to know about the evaluation part. Actually, you are saying about the peculiarities. So, if a person comes with mental peculiarity and at the same time he has some physical peculiarity, I have found. In that case, which is more important for me? Thank you.
I don't understand why you say if the patient comes with peculiar symptoms. Yes, we like to pick out the peculiar symptoms only. If it is mental, if it is general, if it is particular, all the peculiar symptoms. Yes. Again,
More important. He has some mental peculiarity as well as he has some general physical peculiarity also. So, which is more important for us?
Of course, more important is mental peculiarity, but you know, we'll discuss about totality of symptoms afterwards. When you judge a patient to prescribe, you'll have to judge him not only by mental symptoms. Of course, mental symptoms are more important, but you'll have to judge according to mental symptoms, according to general symptoms, and of course, he's complaining particular symptoms as well. But in selection of medicine, he'll have to give more emphasis on the mental, of course, from the general. But you'll have to see that Dr. J.T. Kent, he said that one strong general symptoms can negate 100 particular symptoms. For example, a patient, very cold patient, chilly patient, can you give him iodium? No. A very hot patient, can you give him Suriname? Usually no. So you see the general symptoms are very important because your medicine should conform to his general symptoms as well. But of course, if you compare the importance of general and mental, of course, mental symptoms are more important, and not only mental. You see, even in mental, there are subgroups. When emotional symptom, you will have to give more emphasis on emotional or will symptom than memory symptom. So this will come in our next lecture when we discuss about evaluation of symptoms. Okay, thank you very much.
Thank you, sir.
থ্যাংক ইউ। হ্যান্ড রেজ করেছেন ডক্টর রায়হান, মোহাম্মদ রায়হান, আপনার হ্যান্ড মাইকটি আনমিউট করে প্রশ্ন বা মন্তব্যটি করবেন।
জি, আসসালামু আলাইকুম স্যার।
ওয়ালাইকুম আসসালাম।
স্যার, আমার প্রশ্ন বলতে একটা জিনিস জানতে চাচ্ছি যে স্যারের ক্লাসগুলো ইউটিউবে পাওয়া যায় কিনা, আর স্যারের টেকিং গুলো যেমন ডাক্তার রবীন বর্মন স্যারের ক্লাসগুলো এবং কেস টেকিং আমরা ইউটিউব থেকে অনেক কিছু জানতে পারি, এরকম সুবিধা ব্যবস্থা করছেন কিনা স্যার?
এটা আমরা ডক্টর আনোয়ার পাটোয়ারি এনলাইট করবেন।
ধন্যবাদ। আমাদের স্যারের লেকচার গুলো আপনি হচ্ছে বাংলাদেশ হোমিওপ্যাথিক পরিষদের ফেসবুক পেজে পাবেন। আমাদের ইউটিউব চ্যানেল যেটা আছে সেটাতে এখনো আমরা সেগুলোকে ধারাবাহিকভাবে আপলোড দিতে পারছি না, আমাদের কিছু টেকনিক্যাল ডিফিকাল্টিজ এর কারণে। বাট আপনি আমাদের বাংলাদেশ হোমিওপ্যাথিক পরিষদের যে ফেসবুক পেজটি আছে সেই পেজে স্যারের লেকচার গুলো নিয়মিতভাবে পাবেন, এবং আমরা আমাদের এই লেকচারটি সরাসরি ফেসবুক পেজে লাইভ ট্রান্সমিশনও করি, সেখান থেকে আপনি শুনতে পাবেন। ধন্যবাদ।
জি, থ্যাংক ইউ।
আর কার কোনো প্রশ্ন বা মন্তব্য আছে কিনা? জি, হ্যান্ড রেজ করেছেন ডক্টর দীপ সরকার তো করেছেন। যারা প্রশ্ন করেছেন তারা হ্যান্ড গুলো নামিয়ে ফেললে আমাদের জন্য সুবিধা। স্যার আর যদি কারো কোনো প্রশ্ন বা মন্তব্য না থাকে আমরা আজকের মতো শেষ করতে পারবো যদি আপনি যদি না থাকে।
শিওর নেক্সট ক্লাসের জন্য আপনাদের আমন্ত্রণ জানাচ্ছি। এই পুরো এই যে আমাদের লেকচারটি হবে খুব ইম্পর্টেন্ট, এটা জানি না আপনারা কিভাবে এটা মূল্যায়ন করবেন, খুব ইম্পর্টেন্ট। কারণ আপনি যদি ভালো কেস সিস্টেম নিতে পারেন আপনি ভালো হোমিওপ্যাথি ডাক্তার না এবং আপনার সিলেকশন ভালো হবে না। এই জন্য কেস টেকিং করা, এই যে বললাম লক্ষণ বাছাই করা, লক্ষণকে এভালুয়েশন করা, লক্ষণের মূল্যায়ন করা, এই যে দীপ সরকার বললেন কোনটা বেশি ইম্পর্টেন্ট, মেন্টাল না এটা সেটা, এর খুবই ইম্পর্টেন্ট টপিকস। এবং এটা করার পরে আপনি সিলেকশন কিভাবে করবেন, এটা কি আপনার মস্তিষ্কে যে ম্যাথমেটিক্যাল স্মৃতি আছে এর থেকেই করবেন নাকি আপনার রেপার্টরি হেল্প নেবেন? আবার রেপার্টরি হেল্প নিলে কিভাবে নেবেন? আবার রেপার্টরি যদি না নেন সেটাও ঠিক আছে। আবার মেডিসিন সিলেক্ট করলেন, ওকে, এখন কিভাবে পটেন্সি দিবেন? আপনি যদি 50 মেলাসিমেল দেন 50% দিলে আপনার কোনো সমস্যা নাই, আপনি সবটাই 1 থেকে শুরু করবেন। কিন্তু যদি সেন্টেসিমেল দেন তাহলে এখানে আবার রুলস আছে, এই রুলস আমরা আমরা বলবো। তারপর আপনি দিলেন পটেন্সি, তারপরে তার ডোজটা কেমনে দিবেন, তার ডায়েট এন্ড রেজিমেন্ট কিভাবে ইন্ডিকেট করবেন। এই প্রেসক্রিপশন দিলে রুগী চলে গেল, রুগী তো 3 সপ্তাহ পরে বা 1 মাস পরে আসবে, তখন আপনি সেকেন্ড প্রেসক্রিপশন কেমনে করবেন? এই সেকেন্ড প্রেসক্রিপশন ভেরি ভেরি ইম্পর্টেন্ট। ওনার দেখা যায় ফার্স্ট প্রেসক্রিপশন সঠিক দিছে, সেকেন্ড প্রেসক্রিপশন এসে গড়বড় লাগিয়ে কেসটা নষ্ট করে ফেলছে। যেন ফাইটাম দেওয়ার কথা, সে ফাইটাম না অন্য একটা পটেন্সি দিল, কেসটা নষ্ট হয়ে গেল। এই জন্য সেকেন্ড প্রেসক্রিপশনকে মূল্যায়ন করা কেমনে সিলেক্ট খুবই খুবই ইম্পর্টেন্ট। আবার সেকেন্ড প্রেসক্রিপশন দিয়েও আবার আরোগ্যটা হেডিং এর আরোগ্য নীতি অনুযায়ী আগাচ্ছে কিনা না উল্টা দিকে যাচ্ছে সেটাও বোঝা ইম্পর্টেন্ট। পার্টিকুলার আপনি যদি ক্রনিক মানে রোগী চিকিৎসা করতে চান, এই জন্য এই সবটা জিনিস কিন্তু ইনশাআল্লাহ আমাদের লেকচারে আসবে। একবারে এই যে বললাম কেস টেকিং, সিলেকশন অফ রেমেডি, সিলেকশন অফ পটেন্সি, ডায়েট এন্ড রেজিমেন্ট, সেকেন্ড প্রেসক্রিপশন এবং হেডিং এর ল অফ কিউর, এই পুরো জিনিসটা আমরা এটাতে কভার করবো। এই জন্য যারা আছেন আমার তো মনে হয় এটা খুব ভালো কাজ করতেছেন। বাংলা লেকচারটা আমি এটা তো বিকজ এটা অনেক লম্বা লেকচার হবে, পরে বাংলাটা দিতে পারবো কিনা আমি এখন শিওর না, যদি টাইম পাই দিব, নাহলে হয়তো ইংলিশ লেকচারই শেষ। এই জন্য আমার মনে হয় যারা মনে করছেন বাংলাটাতে আমি থাকবো না, আমার মনে হয় তারা ইংলিশটাতে আসা উচিত। কারণ বাংলাটা, কারণ আমরা ওই যে জেনারেল এক্সামিনেশনের পেইড ক্লাস শুরু করে দেবো আমরা এই হয়তো সামনের মাস থেকে, তখন হয়তো আর এই লেকচার নিতে পারবো না। এই জন্য আমার মনে হয় এই ক্লাসটাতে ইংরেজি তো সহজ ইংরেজিতে আমরা কথা বলি, এটা তো বুঝতে আমার মনে হয় না অসুবিধা হয়। এই জন্য বাংলা লেকচারের অপেক্ষা না করে ইংলিশ লেকচারই সবাই থাকবেন, আমি এই আর্জি জানাই। ওকে ডক্টর পাটোয়ারি।
ধন্যবাদ জানাই আবারও। আমাদের শ্রদ্ধেয় অনেক শিক্ষক আছেন, অনেক শ্রদ্ধেয় ডাক্তার মহোদয়রা আছেন যারা অনেক গুরুত্বপূর্ণ সময় ব্যয় করে আমাদের সাথে ক্লাসের সেই শুরু থেকে শেষ পর্যন্ত থাকেন। বিশেষ করে আমাদের সম্মানিত সভাপতি স্যার ডক্টর শেখ ফারুক এলাহী স্যার, যিনি প্র্যাকটিস করে সারাদিন, তারপরে আবার দিন শেষে আমাদেরকে নিয়ে এই মধ্যরাত পর্যন্ত প্রায় বসে থেকে এই লেকচারটি আমাদের জন্য অনেক কষ্ট করে পরিবেশন করেন। সবার জন্য দোয়া চাচ্ছি, সবার কাছে আল্লাহ রাব্বুল আলামিন যেন সবাইকে সুস্থতার সহিত দীর্ঘায়ু দান করেন। আর পরবর্তী ক্লাসের আমন্ত্রণ জানিয়ে আজকের মতো এখানেই বিদায় নিচ্ছি। সবাই ভালো থাকবেন, সুস্থ থাকবেন, সুন্দরভাবে কাটাবেন আপনাদের জীবনের প্রতিটি মুহূর্ত, এই দোয়া কামনায় আজকের মতো বিদায়। আল্লাহ হাফেজ। আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহি ওয়া বারাকাতুহু।